some COVID-19 updates now. The Nigeria Center for Disease Control, that's the NCDC, reported 594 new cases of COVID-19 in 22 states overnight, taking the country's total number of cases to 22,614. Of the 594 new cases, Lagos recorded the highest figure with 159 new cases, followed by Delta with 106, Ondo 44, the Federal Capital Territory 34, Oyo and Kaduna recorded 33 new cases, Enugu 26, Katsina 25, Imo 22, Adamawa 15, Ogun 12, Osun 11, Abia 8, Rivers 6, Nasarawa, Bauchi and Niger each had 5 new cases, while Kebbi had 4, Ekiti 3 and Plateau and Taraba each had 1 new case. A total of 7,822 people have been discharged, while 549 persons have died from COVID-19 related complications. More Nigerians stranded outside the country are still returning home. This time, 167 Nigerians from South Africa stranded by the coronavirus lockdown have arrived home on a flight from Johannesburg. The 167 evacuees all tested negative before being evacuated. They will now proceed on 14-day self-isolation as mandated by NCDC, Ministry of Health and Presidential Task Force on COVID-19. A public health specialist and CEO Medway Health Limited, Dr. Tuyime Bawadu, joins me now via Skype to talk more on this. Good morning and thank you for joining us on TVC Breakfast.
Yeah, good morning.
Now, Nigeria has crossed the 20,000 mark, and across the world, the numbers keep increasing. Now, a lot of concerns with regards to efforts being made and the resultant effect, especially when it comes to educating people. The questions have arisen as to if it is really making as much impact, especially with the numbers that we see rising.
Let's give it to the government that they're trying to do their best, first and foremost, but the best is not enough. With the rising cases, we have seen now that we have lost control in a way of the COVID. Now, what we now need to do, because if you look at it, the government is telling you that you have to do more personally to ensure you prevent yourself from COVID. What we need to do is that the state needs to devise means of getting to the community and ensuring that stabilization happens at the level of the community.
Before we get to what the state needs to do, when you say it shows we have lost control, how do you mean?
Wait a minute. Now, the discussion on front pages of newspaper or the dominant discussion in the media as it is now is moving away from COVID. Where gradually the lockdown is being breached, without recourse to any control. People are not wearing face masks. In fact, the doubt about the COVID is still existing in the nation. A lot of people don't doubt the COVID. They do doubt the COVID. They doubt the numbers. People are even saying that it's a business means. And even if you look at some commentaries coming from even dominant newspaper and radio stations and media, you see that the doubt is being accentuated. So now, how do we get control of this back? So with that, you can now feel that government, we've lost information control. People are not really believing in the COVID, except occasional cases that happen now because they have been asked the question that where are the people that are suffering from COVID? But having said that, and given the fact that government himself said that go back and try to protect yourself from COVID, it becomes important for each state to fashion out means that will get to the local government as much as possible to deal with COVID, to look at...
So invariably, what you're trying to say is that if government involves local communicators, it will be able to get a hang of, take control back with regards to information, invariably transforming attitudes of people towards this.
Indeed, because let's face it, the smallest unit of governance is the local government. We have CDAs there. Have we set up what I can call a local community, a local COVID-19 response team that will look at each of the locality and look at the factors driving the number of COVID-19 in those communities? Are they having a lot of bar open? Are they having hotel? Are they having things that will really encourage the COVID? How are they engaging those people? So government has personalized a lot of those things, and their personalization has failed essentially. And that's why we see, even if you want to go from here to Kano, you will go freely. All those lockdown things are just rules. Nothing is happening. So government must first of all admit that, first of all, though they are not testing enough, the communication is so deficient, and we have to take it to as low level.
Well, according to reports, the government is looking at further easing the lockdown measures despite the rising number of cases. Is that the way to go at this point?
Again, if government does not ease the lockdown will not work again. Obviously, it won't work again. People have lost confidence in the effectiveness of the lockdown. What we need to do exactly is to see how do we curtail COVID-19 while allowing economic activities. So now, we've seen the rise. The rise is embarrassing. 2 in February, 350 something in March, 2,000 plus in May. By April, by the end of May, we're having more than 11,000. By the end of this month, I'm sure we're going to get close to 30,000, So now, what we need to do essentially is to define ways to reduce the transmission while we're opening up to something. And then this can only happen when we try to cool down at our activities at the level of the local government. At the level of the local government, we need to act so locally. We need to empower the people through education, but even beyond prevention, we need to look at it that what then can we do if you suspect you have COVID? The symptoms and signs must be taught to the people in the language they understand. What they can do must be told to them in the language they understand, and government must provide support at the level of the Community Development Association. So that is where we are now. If we choose to close the economy again, the hardship will increase. Don't forget, Nigerian economy is projected to contract as much as by 3.2% this year. In fact, because of the loss of revenues, recession is looming at us in the country. If you lock down the economy again, we are not going to see much improvement.
But how challenging would it be to achieve the flattening the curve as well as economic growth at a time such as this?
Now, the delicate balance between life and livelihood is still staring us in the face. Now, what we can do exactly, like I said, is to deepen communication, not only on prevention, but also on identify the early symptoms, and even at the local level, and see what to do. Now, we have to deploy the stimulus, as it were, because government is not involving sufficient stakeholder as much as possible. They are running the shows by themselves alone. Let me ask you, for instance, as long as we're doing the interstate travel, tell me what government has done at the level of National Union of Road Transport Workers to get them involved. As long as churches are demanding to open up, tell me what government has done at the level of the pastors and the parishioners to reduce the COVID. Government must be able to look at how to act from the level of Community Development Association. That's the minimum. They must be able to understand each street, what they need to do at each of the streets, and how to ensure that even if anybody is found flouting any of those rules, without necessarily threatening to arrest, government must be able to impose observation through the CDAs. Please put on your face mask. Please, you cannot do this. Now we look at those communities that is going to have high transmission of those diseases. We must be able to act at that community. Are we putting up a portal for washing of hands? Are we putting up a system for distribution of face masks? Are we putting up a means by which they can purchase hand sanitizer at the cheapest rate? Are we putting up a communication mechanism that will allow them to communicate, to tell people when they are having the started symptoms and report to the necessary authorities? These are the actions that need to be defined as long as we want to open up the economy. We cannot, if we shut up the economy, we're going to mess up the whole economy. We're going to mess up even the control of COVID-19.
Dr. Tuyime Bawadu, thank you for speaking with us.